what does it mean to have an addiction? Are there specific criteria that qualify as quote unquote an addiction? Like, are there specific symptoms and the criteria? Maybe you can talk a little bit about that.
Yeah, so for psychiatrists, the Bible for us is the DSM, Diagnostic and Statistical Manual. This is a book that has the symptoms of all mental health problems. One of them is substance use disorder or the addiction. In this book, they put certain symptoms, and if you have these symptoms, we're gonna call this addiction problem. And then they put, like 11 symptoms. And if you have maybe 3 or 4 of these symptoms, this means that you have addiction problem. I can go through all these symptoms very quick. So for example, the first symptom is when you have addiction problem, you're gonna give up important stuff in your life. Like you're gonna give up social, occupational, recreational activities, your physical appearance, sometimes even grooming habits. Also, addiction can cause failure at work, at school, at home. So people who have addictions, they have poor work performance and stuff like that. Also, when you have addiction problem, usually there is social problem associated with it and interpersonal problems and sometimes legal problems. So all what I'm talking about now, these are the symptoms of addiction. Another symptom is you use addictive substance or addictive behavior when it is physically dangerous. For example, you drive a car while you are intoxicated, or you operate a big machine and you are drunk. So these all are symptoms of addiction. Another important one that was added recently is the craving. Like people, this is one of the major symptoms. You will have craving all the time toward this addictive substance or addictive behavior. The craving means like a strong psychological desire to obtain the drug. Symptom number 6 is you spend so much time trying to obtain and use and recover from the effect of the addictive substance. So maybe you spend 10 hours a day trying to figure out how I'm gonna get this, like how I'm gonna get heroin, how I'm gonna use it, and then after you use it, get intoxicated. It's gonna take me a few hours to recover from the effect. So the time also is a symptom of addiction. Another symptom is the tolerance. Tolerance means like you gradually increase the amount to achieve the same effect. So you inject 1 gram of heroin today, after 6 months it will be 2 grams of heroin. Okay, why you are increasing the dose? To get the same high or the same rewarding effect. Another symptom is the withdrawal symptom. When you stop using the substance or you stop the addictive behavior, because addiction is not just as a substance. Addiction could be also behaviors. Could be gambling, it could be food addiction, work addiction, sports addiction, sex addiction. So we added recently also the behavioral addiction. But you will have withdrawal symptom when you stop the addictive substance or the addictive behavior. Sometimes the withdrawal symptoms are physical and sometimes it is psychological. So for example, with opioid, like with morphine, heroin, prescription drugs, all these will be more psychological symptoms. So you will have body ache, flu-like symptoms, back pain, headache, diarrhea, GI symptom. These are physical. But also you might have psychological withdrawal symptoms, which usually happen with the stimulant like cocaine, amphetamine, these substances. And the psychological symptoms could be like depression, some depression symptom, anxiety, irritability, restlessness, lack of pleasure. And this is what we also see with addictive behaviors. That people will have psychological symptom, not physical withdrawal symptom. Another symptom is you take larger amount, more than what was intended. So let's say you say, I'm gonna smoke 1 joint of marijuana, and then you end up smoking 5 joints. You're gonna say, oh, I'm gonna take one pill of oxycodone, and then you end up with 10. So you always intended to use a certain amount for a certain time, but you take larger amounts. Number 10 is will be unsuccessful attempt. You try unsuccessful attempts to quit. You're trying to quit, but you can't quit. And we know addiction is a chronic problem, and relapse and remission is one of the the symptom of this disease. The last one would be you use addictive substance despite the knowledge of negative consequences. So alcohol will worsen the stomach ulcer. You know that marijuana it trigger some hallucination. You know that cocaine cause you legal problems, or you lost your previous jobs because of drinking. So you know that this caused the problem, but you still using it. So you see all these symptoms. This is what addiction is, according to the DSM. If you look at as American Society of Addiction Medicine, the definition is a little bit different. But we can talk later about it. Like the DSM, the symptoms that I say, this is one way of looking at addiction. There is different ways of looking at addiction. Thank you.
Thank you for breaking that down. That's actually really helpful. So in terms of actual diagnosis, because I think you said 11 of them, so how many do you need to be diagnosed as somebody who's addicted to whatever it is?
So we classify, according to DSM, we classify this the addiction to mild, moderate, severe. So if you have 2 to 3 symptoms, we call this as mild addiction problem. If you have 4 to 5, this is moderate problem. If you have more than 6 symptoms, then this will be a severe substance use or severe addiction problem. So mainly, if someone has an addiction, or mainly if someone start to focus on one thing in life, like forget about the drugs. If someone focus on one thing and start to exclude other things in life, social, occupational, school, interpersonal, like he exclude everything and focus on one thing, and this one thing cause him problems at home, at work, at school, then we start thinking about addiction. But if we look, American Society of Addiction Medicine, they look at addiction different a little bit.
Very interesting. So I'd love to kind of dig deep into the root, right? Because I love integrative medicine, and I'm always looking more for root cause of certain conditions, whether they be mental or physical. So I'd love to talk a little bit about the root cause of addictions. I know that so many things kind of trace back to childhood traumas, things, growing up, and I'd love if you could maybe kind of talk a little bit about that, kind of the root cause of a lot of different addictions, and not necessarily even substance abuse, but more like even like gambling or addiction to porn, or addiction to toxic relationships, for example. So maybe you can kind of touch upon the root cause of most addictions that you've seen in your practice.
Yeah, so addiction is a complex phenomena, okay, and there was different ways of looking why addiction happen, and why some people get addicted and others don't get addicted. So some people, two people will, one will eat chocolate, another one eat chocolate. One of them will get addicted to it. Another person will take one piece of chocolate and he's happy with it. So one of the obsolete models of looking at the addiction is the moral model. These people who have addiction are people who have weak character, or these are bad people doing bad things. Okay, this is a moral model, and this was up to 1930, I think, when we didn't look at it as a disease. We look at it as a sign of weakness, as a sign of narcissism. There is another model, some people think, oh, addiction is caused as a self-medication. So if you struggle with sleep or insomnia, you're gonna get addicted to sleeping pills. If you have depression, you're gonna try to find something that make you happy, so you will get addicted to addictive substance. Some other people will say, oh no, it is a spiritual thing, because you don't believe in God, that's why you are using these substances, or you easily get addicted to this stuff. Other scientists will believe it is genetic predisposition, and that's true. Like, there is a genetic predisposition for addiction, and I would say like 40 to 60% of the risk for addiction is genetic. There is also the biomedical model, which is, you start using a substance, you like it, it causes brain changes, and then because of these brain changes or changes in brain structure, it's gonna change the brain function, and then you cannot stop. But to be honest, is which model explain more why some people are addicted and why others are not? It is a combination of factors. It is not one way of looking at it. It is bio, psycho, social, spiritual. So there is a spiritual part of this problem, but there is no one specific cause to the addiction problem. So you'll see, sometimes it is a personality. Some personality characteristics are tended to be addictive. Like, for example, people who are more rebellious, people who are more independent, people who are more pleasure seeking, they tended to have more addiction problem. Still, I believe part of the problem is biochemical changes that happen when you start using a substance or addictive behavior. Again, the genetic component are very important, and we can look at this through the twins studies and the family history. So like in my assessment, when I see a family history of addiction, I know that there is a strong predisposition to this disease. Another thing is also the family. So the history, like a family history, like growing up, was there any abuse, divorce in the family, poverty in the family, any parenting style, like authoritarian versus supportive parenting style. All these are all contributing factor. School performance, a study shows that your school performance could be a risk factor. So if your performance you are not doing great at school, you are more likely to have addiction problem. Another problem is the peer pressure. This is one of the strongest influence of addiction. In regards to abuse, I think the sexual abuse is the worst. So there are so many studies show that, for example, rape victims are 5 times more likely to use prescription drugs, and 10 times more likely to use hard drugs. So it tells you that the history of sexual abuse, sexual assault is an important factor. Another thing is also the society and the media. Like there is lots of movies, videos, music, and TV that glorify drinking behavior. So the way the society look at the addiction, this also can increase certain addiction in certain countries. Another one is availability. There is so many studies showing the more licensed liquor store in certain area, the more likely individual will have drinking problem. So the availability also is one of the factors. Advertisement about certain subjects, like advertising of alcohol, or showing alcohol that it creates environments that suggest alcohol consumption or even overconsumption is a normal activity. So advertisement is a factor, availability is a factor, the society is a factor, the culture also is a factor. Like you find, because a fast-paced culture like US and Canada, you'll find cocaine is more common in certain countries. The alcohol is prohibited, 100% prohibited. So you'll find in certain countries, because of religious causes, that there is no addiction to alcohol. Another thing, I think also one of the major risk factors is early using of a substance. So if a teenager starts using drugs, cocaine, alcohol, amphetamines around 15, 18, this increases the chances in adulthood they're going to have addiction problem. So all these contribute, like, so the more the risk factor, so all these are risk factor. It's going to increase your susceptibility to have addiction problem. So the more the risk factor, especially the main one will be the genetic one, which represent 40 to 60% of the problem. The more the risk factor, the more the tendency to have addiction problem, and the more that you're gonna try to, or the more you will have craving for certain things in life that you're gonna try to use just to feel some pleasure and some reward. This is the way I look at it.
Very good. Thank you for breaking that down. Really, really interesting. I mean, I think we all know that genetics plays a role, but, you know, I always wonder, is it actually in your genes, or is it more of just the structure of the environment that you grew up in? You know, like if, for example, children of alcoholics are more likely to become alcoholics because, yes, there's probably a genetic component, but then you're also seeing, you know, your parent drinking alcohol, and that's kind of normalized. So that's really interesting to hear that. I wanted to ask you, actually, because I know that a lot of people who become addicted to different substances and different behaviors, it's almost like they're people who need that like dopamine surge, that really intense dopamine surge, and they become addicted to that. And we know that dopamine is a neurotransmitter that's like the excitatory one. And so I know that certain addictions are actually due to either dopamine deficiencies or people whose brain, for whatever reason, they just need that dopamine surge. Like I've seen that a lot in certain personality disorders like cluster B. I would love to hear your feedback on that as well, whether or not you think the genetic component is actually genetic, or is it more of a kind of like modeling in, you know, the environment a person grew up in, but also the dopamine link, if you've seen that at all.
Yeah, so one of the theory about addiction is that low dopamine tone, which what you are referring you. Some people will have low dopamine as a substance, also as receptors for dopamine. So basically, their ability to feel pleasure is less than others. That's why they are seeking, you know, the like pleasure-inducing behavior or addictive substance. Why some people will have low dopamine. So, okay, both of us, we agree that some people will have low dopamine. Is it a genetic? Is it epigenetic? Is it the environment? Is it a combination? It is always a combination. You know, so you're... and another way is the inflammatory process, because we look, most of the mental or psychiatric illnesses, we look from the inflammatory model of looking at it, is there is a chronic inflammation causing all these changes, because disturbance in dopamine also goes disturbance in serotonin, norepinephrine, and all these substances. So I will go back. Yeah, there is a genetic component, but also there are environmental factors. Environmental factors could be the family, could be your childhood experience, it could be your diet, it could be exercise, it could be lack of spirituality and the inability to connect with your spirituality, it could be psychological trauma. So adding up all these factors. So when I say it is a genetic, it doesn't mean like susceptibility, it doesn't mean inevitability. Like if you are susceptible to addiction, it doesn't mean 100% you will have addiction problem, because the environmental factor will be contributing factor. That's why when like when I started practicing psychiatry and therapy, the Western model of looking at things is that, okay, they have a problem, medical problem, I give you them medication to fix this problem. But yeah, this could work for high blood pressure or diabetes. However, still the holistic approach is better than just using a medication. But when it comes to mental health, you will need to use multiple approaches to fix the problem. That's why we will need to look. Okay, dopamine is low. Okay, dopamine is low. Why? Is it a genetic? Is it a diet? Is it an inflammation? Is it a history of abuse? Is it a toxic relationships that you are in now? Is it stressors? Is it you are a new immigrant? Is this so? It is a multiple contributing factor, and the more the risk factor, the more the chances you will have the mental health problem or the addiction problem. So as a physician, we all need to fix or try to change this environmental factor. We can't so far we cannot, to some degree we cannot change the genetic. We can, yes, there is epigenetic, we can turn on turn off some genes by changing environment, but still the genetic factor is important. We can't there is no enough gene therapy studies now that we can apply even for screening. Even we have so many trials on how we screen people, like can we do a genetic test to know if they have depression, or genetic test to do they have addiction. These up till now, these are not that successful. That's why we will need to again rely on a holistic approach or environmental approach in addressing these issues.
So glad that you mentioned holistic approaches, and I'd love to talk a little bit about that as well. And I'm going to kind of justify the Gut Healthy Room namesake by talking a little bit about how our gut health kind of plays a role in that, especially with dopamine and serotonin, as you mentioned. I think diet and then just environment plays such a huge role, because these neurotransmitters are made in our gut, and they're made from precursors that we eat, and they really do affect our mood. So I'd love to talk about that later. But yeah, I'd also like to hear about your approaches, holistic and then medications. But also, I'm sure that you approach mild, moderate, and severe addictions differently. So I'd love to see how you approach them differently. I'm assuming that you probably will try holistic approaches with the mild and the moderate, but I'm curious if you ever do with the severe addictions, and also how do you treat different addictions, like we know alcohol addictions, withdrawals are dangerous, like people can have seizures and they need to be monitored during withdrawal. But for other substances, I'm curious how you approach different addictions through different holistic measures, but also through medications.
So, for recovery plan, there is a foundation. So I at the beginning, I teach the patient, there is a biopsychosocial spiritual treatment model, which it doesn't matter what kind of addiction you have. It doesn't matter even if you have a psychiatric illness or not. Patient will need to know that exercise is important, and we need to address how much exercise and how frequent they're gonna exercise. Also the diet, like we have with all my patients, we have a whole session about talking about the diet and what is different diets that increase the inflammation and increase depressive and anxiety symptom, and what diets that as anti-inflammatory. So this is a biological. So there is exercise, the diet. Also, we have a session about sleep hygiene. We teach them how you're gonna sleep, because most of the healing and recovery happen when you are sleeping. So these are, before we are diving into medical or medication or what kind of medication, we teach them, okay, this is an important part of recovery process: the exercise, the diet, the sleep hygiene. And some patient will need medication. So for example, someone have addiction at the same time they have depression, so we need to give them antidepressant, and this will need some experience from the doctor. Some patient will need two patients will have depression, some of them will need antidepressant, others will not need antidepressants. This will need to a lot of experience from the treating physician. So this is the biological part: exercise, diet, hygiene, sleep hygiene, and medication. The psychological health is also important, so we teach them how to journal your feeling, how to write your thoughts, behaviors, actions, and if there is a psychological problem, we get them into counseling, individual counseling or group counseling, and we rely more on the evidence-based techniques like cognitive behavioral therapy, dialectical behavioral therapy, and we explore also the history of trauma and the coping mechanism, and we teach them like relaxation techniques and meditation techniques and breathing exercise. This is the psychological part. So again, the treatment should be biological, psychological, also social. We need to address relationship issues. Relationship issues could be at home, at work, at school, with volunteering. If they don't have a social life, we try to create a peer support. Like in my program, we have different group therapy where we create peer support groups where people support each other, because no man is an island. You can't live by yourself, you can't recover by yourself, you need others around you, and that's why the 12 steps meeting are very successful in helping patients with addiction, mainly because they provide the social part of therapy. And the last part is the spiritual. Connect with your spirituality, and I wrote a book about this part, because for some people it is very confusing. What do you mean like spiritual? Now I understand biological, the exercise, diet, sleep, the psychological, the social. What do you mean by spiritual? So I tell them like this will the spiritual therapy will help you to discover your true self and help you to feel supported, not alone, bring positive energy and positive, feeling like joy and peace. That's why I wrote a book about 7 techniques or 7 principles. When you apply them into your life, it's gonna help with recovery plan. So you see, the biopsychosocial spiritual, this is the foundation for any treatment plan. Depending on what kind of addiction, I might need, like, for you mentioned alcohol. With alcohol, especially people who are drinking huge amount of alcohol, we will need detox. Okay, so it will take 1 week to 2 weeks. You're gonna stay in a place where they medically gonna help you to go through the withdrawal, and the withdrawal will not be that painful, and they give you some medication to just prevent the complication of alcohol withdrawal. Not all addictive substance will need this part of treatment, the detox, but like alcohol and benzodiazepines are the one are mainly will need the detox period. After that, you might need also rehabilitation center, because the first 3 months in recovery are the most difficult 3 months, especially when you have severe addiction problem. When we talk, there is mild, moderate, severe. When I say severe addiction problem, it is not just severe means like you have many symptoms. You have also many complications, like problems at work, problems with the law enforcement, problems with your wife, problems, so many problems. Okay, so we will need 3 months to stay away from all triggers, okay, until there is a biological and chemical changes that happen in the brain within these 3 months. So for some people, depending on the severity of addiction, they will need to stay in a rehab from 1 month to 3 months. Okay, and after that, so we started again. If I'm talking about someone who have severe alcohol addiction problem, what is the plan? I said the overall plan, we will need to look at the biopsychosocial spiritual approach of therapy. They need to know that. But practically, what we're gonna do now, if they have the severe addiction, we will need 2 weeks of detox, then 1 to 3 months rehab, then continuing care. continuing care, this is for how long? For the rest of your life. What? Yes, for addiction treatment, it is not 1 week, it is not, it is ongoing. And we have in the big book, which is the book for Alcoholic Anonymous, there is a statement, they put it there: once an addict, always an addict. Especially people who have severe addiction problem. What do you mean once an addict, always an addict? This means once an addict, always you will need to take care of yourself. It doesn't mean you will have to be using drugs all your life. No, you will need a chronic care model or a continuing care model, which is what I'm creating in my clinic. That the patient, to some degree, they will need maybe one counseling session every week or every month or every 2 months, but or attend a meeting once bi-weekly or once a week. For how long? For the rest of their life. Why? Because this disease tended to be chronic, and relapse is one of the symptoms of this disease. So we will need to be working on the treatment. So, but if they finish detox and they finish the rehab and they avoided all the triggers and they change their lifestyle, what's we gonna be doing then in this therapy, the ongoing care? They're gonna be doing the bio, psycho, social, spiritual. They're gonna be doing someone like they will need someone to just design a recovery plan or be the accountability guy for them. Like how we're gonna do the exercise, the diet, how is your sleep, is there any relationship problems, how you connect with your spirituality, do you journal or not, do you wanna, what kind of self-help book you are reading, what kind of self-help talks you are listening to, and so on. So this is summarized treatment of addiction, but of course we can go deeper into how we're gonna do more about the therapy. Thank you.
I love that. Thank you so much for enlightening us. Couple of questions I had. Number one, I love that you said this is a lifetime thing where you really have to kind of just be mindful, right? And proactively work on your addiction. And I think just in general, mental health has been kind of dismissed as a whole in that, like you can't really be helped. But this is a condition, addiction is a medical problem, just like if you have diabetes and you have to take insulin for the rest of your life. So I'm really glad that you highlighted that. And I think hopefully in the next few years, there will be less shame about treating this more as a chronic condition versus kind of like a taboo, a derelict of society kind of thing. So I'm really glad that you mentioned that. I also wanted to maybe just for people listening, I kind of know a little bit about each, but I would love for you to also talk about just kind of like briefly the difference between cognitive behavioral therapy and dialectical behavioral therapy. I know cognitive behavioral therapy is kind of like a fairly new approach, and I know it's been pretty successful with anxiety conditions and OCD. But I wanted to kind of maybe just give us like, 1 or 2 lines of like how they differ and how they're used with addictions. That would be great if you can kind of just highlight that as well.
Yeah. So in at my clinic, what we use cognitive behavioral therapy, dialectical behavioral therapy, and the 12-step program. I think the 3 of them is adding something to the patient. But what is the difference? Cognitive behavioral therapy is you rely on changing the thought, how the patient think about life and about addiction. And then when we change the thought, this will change how they feel. And when they change how they feel, this is gonna change their behavior. Okay, for example, for an addiction, when you do cognitive behavioral therapy, what do you exactly do? Because in every disease it will be, the theory is the same, like the model is we work on, so cognitive behavioral therapy, we work on thoughts, feelings, and behavior. And we try to change them from irrational, negative, non-productive thoughts and action and behavior to more rational, logical, positive thoughts and feeling and behavior. But if we, this way of treatment is a cognitive, how they're gonna do it with addiction. For addiction, for example, we will be asking the patient to write down the positive impact of recovery versus the addiction negative impact. So this is a basic exercise in CBT when we are treating addiction. We ask them, okay, before we start anything, can you spend an hour or 2 hours trying to identify at least 10 ways that your substance abuse has negatively impacted your life? They're gonna ask, what do you mean? I want you to think about how cocaine affect your health, relationship, self-esteem, employment, finance, friendships, family relation, children, everything. Tell me how cocaine has a negative impact on your life in general. Then they write it down, and this is so part of the cognitive therapy is we change cognition, we change how the people think about the addictive behavior. Because as American Society of Addiction Medicine, one of the symptoms they put for addiction, there is diminished recognition of negative impact of addiction. This is part of the disease, that people who are overindulging in certain addictive substance or behavior, they cannot see the negative side of addiction on their life and lives of others, and they try to do a defense mechanism. We call it rationalization. Oh, I'm using this drug. Oh, my life sucks because of my wife. Oh, my life sucks because of my employer. No, your life sucks because of your addictive behavior, but they cannot see that. And why they cannot see this is not because of stupidity or lack of, or weakness or personality problems. No, it is because addiction, after a while, it causes prefrontal cortex changes, and we call it hypofrontality. So your brain and your ability to analyze and plan and to see and to correlate stuff decrease significantly with using especially hard drugs. So one of the cognitive therapy technique is we tell them, okay, please identify how the addiction is causing problems in all life area, and if they cannot see it, the therapist will be able to help them identify them. Okay, and then we ask them on the opposite side, what do you think recovery will help you with relationship and self-esteem and employment and the legal problems and all this stuff? So this is one of the thing. Another major part of CBT for addiction is we identify the trigger. What is triggering your addiction? It could be, we call it people, places, things. It could be certain people is a major trigger. Certain places like bars or clubs. It could be certain things like a spoon, a lighter, a needle, or when you see certain things in TV, this trigger craving. And sometimes the triggers are external and sometimes internal. Lots of people that I see for addiction, the trigger for a relapse is internal feeling of loneliness, feeling of grief, depression, frustration, anger. These also are triggers. So part of the cognitive behavioral therapy is to identify the trigger and identify the negative side effect of it, and also identify the previous relapse. We have to study when and where and with whom and why you relapsed in the past. So we call it relapse symptom line. We ask them to look 10 years in the past. Okay, why did you relapse last year? Why did you relapse 2 years ago? When did this happen? Where? With whom? Why? What was the situation? And this is also part of it. And yeah, I don't want to go into details, but also we look at the craving, how we're gonna cope with the craving, because craving is one of the symptoms. Okay, people who have food addiction, they have craving. How we gonna cope with the craving? How we gonna? We will need to have a plan for craving. Whatever is addiction, is it porn addiction, food addiction, work addiction, addictive substance, and so on. Okay, so this is the cognitive, and also we create a routine for the patient and the schedule. Okay, at this time you go to the gym, at this time you visit your kids, at this time you're gonna journal, at this time you're gonna pray. So part of the CBT is we also create, we call it aftercare plan treatment. So this is the CBT. If you ask me to talk about, so what is DBT, the dialectical behavioral therapy? Dialectical behavioral therapy focus on 4 major things. So it is, you can say it is a combination. Dialectical behavioral therapy is a combination between CBT and Buddhism. So the lady which who developed the DBT, she spent 2 months in a Buddhist monastery, and then after these 2 months she came out and say, you know, what I learned in this monastery or with these monks is something gonna help my patient. Then she come up with dialectical behavioral therapy, and the main component in dialectical behavioral therapy, a patient will learn mindfulness and the meditation techniques, which is part of the Buddhist philosophy. Okay, patient will learn something called interpersonal effectiveness, which is they're gonna learn how to communicate and the positive communication and how to resolve a conflict. So it talks mainly about relationship problem. Also there is part which is the stress tolerance, which patient gonna learn a stress management technique. So you tell me, okay, so which patient gonna benefit from dialectical behavioral therapy that teach mindfulness and the communication and the stress management, and which patient gonna learn benefit more from the CBT? Me personally, I believe that all my patients will need to do both. That's why we run seminars and the groups that teach both. So patient, let's say they spend 6 months learning CBT. After they finish, they learn DBT 6 months. And then after that, we do something called the 12 steps, which is, these steps are mainly designed for addiction problem, but it is also designed for spiritual enlightenment. But using 12 steps is a little bit controversial, and a little bit, some patients will see it as a positive, some patients see it negative, because there are lots of parties in it talk about higher power, and this is something some people will believe in it, some people will not believe in it. But anyway, I wrote a book about spirituality, so people who don't have a religious background, they can still fulfill their spiritual needs without getting into the 12 steps or religions. Thank you.
I read your book. I thought it was great. I highly recommend it to anyone who is looking to just improve anything in their life. It's a really good book, and it touches on what you just mentioned, which is spirituality, with or without a religious affiliation. They've done studies on people who pray or meditate daily, and they found that their lifespan, regardless of any other medical conditions, their lifespan compared to others is 5 years longer. And so there's definitely a component to spirituality, but also in regards to what you said about CBT, CBT is very successful in treating so many conditions because really our mind, our thoughts really, really are important and powerful, and they can affect the way that we behave and the way that we feel. And it's funny, you mentioned this, and I just made a recent Instagram post about that specifically, and I'd love to share it. So, interestingly enough, I had blood work done, just kind of routine blood work done about a week ago. It was time to do it. I hadn't done it in a while. And one of my blood test results was a CBC, which checks your blood count And so my hemoglobin, which checks the amount of blood I have, was very low. It was 9.4, which was startling to me because I had not had any symptoms of anemia at all. I was feeling great, energetic, but I was just really surprised. And, then my mind started kind of wandering to, oh no, do I have colon cancer? Do I have this? Do I have that? And, oddly enough, after that blood test, I started having symptoms of anemia. I started having shortness of breath, and I started feeling, fatigue. And these were very valid symptoms. I mean, there's no way that I was making that up. I mean, these are very valid symptoms. So oddly enough, just actually 2 days ago, I repeated the blood test because I was like, this is really odd. It turns out it was a lab error, the initial one, and my blood count was normal. But the funny thing is that my mind decided to have its own diagnosis, and my mind started making my body feel certain things. So, you mentioned this, thoughts really can make a difference. And I think that is why CBT is so successful in so many different conditions. And I wasn't aware of DBT, but I think that adding the spiritual component is definitely something also that's really important. I'd love to ask you, in terms of like when you see your patients with addiction problems, what's the relapse rate? Like, how many actually go on with the three main components of CBT, DBT, and 12 steps? What is the relapse rate? I'm assuming it's a lot lower than it used to be with those three incorporated. And also, when do people, like, what is the like crucial time period of when someone relapses? Is it early on that you see more relapse rates, or would love to hear your feedback on that?
Relapse rate is 90%.
Wow. Even
Why?
even with these three
Yeah.
programs incorporated. And is the relapse rate higher for certain addictions? Like, are
Yeah.
some addictions like more likely to be improved upon?
Depending on the severity of the addiction and severity of the complication of addiction. If someone lost his house, lost his family, he lost everything in his life, yeah, there is a higher rate of relapse. But this is one of the basic, teaching for the patient when we do at the beginning. Relapse is one of the symptoms. It's like diabetes. One of the symptoms, your blood pressure will be high. Okay, so relapse will be one of the symptoms. Blood sugar will be high, or migraine. Some of the symptoms, you will have a headache. This is part of. So one of the symptoms of addiction is relapse. Is it? But is it a sign of weakness or sign of failure of treatment plan? No, will be a learning opportunity. This is what we tell a patient at the beginning, that relapse will happen, but we want to use it as a learning opportunity every time. We differentiate between something called a relapse and lapse, or a slip, or for relapse means you go to square zero. Okay. Lapse means like you use this substance, or you used the addictive behavior, but you still maintaining your recovery. You still have a plan. You still go to your meeting. You still journal, read, do your spirituality things and stuff like that. So, but when they relapse or lapse, we ask them, what did you learn from it? What was the cause? What was the trigger? When did this happen? How did you feel about it? What was the internal feeling which triggered this relapse? And then we use it as a learning opportunity. And like, if you tell me average patient would relapse at least 9 times before they achieve full recovery. And again, so people who are addicted to porn or addicted to food addiction, okay, they're gonna relapse. They're gonna start. They're gonna do like keto diet or low carb diet or whatever. Go to the gym, and then one day someone invites them for a dinner, and they eat junk food and they eat high calorie food, and then they feel bad about themselves and they continue eating the same unhealthy food for 3 days. But then we use this event as a learning opportunity, and then we go back to our recovery plan, but we use what happened as a learning opportunity. If you ask me which part, we always say that which period is the most difficult, especially with severe addiction or addictive substance. I would say 3 3 3. Like the first 3 days are the most difficult 3 days in withdrawal, and the first 3 months are the most difficult 3 months in avoiding the triggers, and the first 3 years are the most difficult 3 years in life, because the fMRI studies show that the brain will take up to 3 years to change, to see like the image, the fMRI images, the scans it change, and the biochemical it change, and the reward center and dopamine level it change to normal level after 3 years. So I would say the most difficult part would be for severe addiction the first 3 years. But if you ask about days, it will be the first 3 days. If you ask about month, it will be the first 3 months.
Very interesting. I didn't know that. That's really, really interesting. Do you find more success with specific addictions? Like, is someone more likely to quit nicotine, for example, or I guess what's the addiction that you've seen like most responsive to treatment, and what's the one that's least responsive?
To be honest, I can't. So the addictive substance will be harder to treat than the addictive behavior. Okay, but depending on the addiction potential of the substance, like if you compare nicotine with heroin, which one will cause major changes in the brain structure, it will be heroin. Which one will hit hard the reward center, it will be heroin. But still there is genetic differences between people susceptibility to different addiction. So I have seen patient to quit smoking is easier for them than quitting junk food or food addiction. You see what I mean? So for some people, quitting cocaine is easier than quitting opioid, because there is it tastes different for them. You know, I'm sure there are certain, even with away from the addiction part, for food, some people will taste will like certain food, some other will not like it at all. Why? Because some people, for them, this food, it tastes good, it activates reward center differently than others. The same with addiction and addictive substance and addictive behavior. Everyone will be different. That's why we ask, what is your drug of choice, or what is your addictive behavior of choice? Okay, so we will know this is the most difficult part. To compare, to make to generalize, I would say the hard drug are the more difficult, but the success will rely mainly on the plan and the support and the family support and the community support and the holistic approach and the peer pressure, and it's multiple factor contributing. It is not the substance or the behavior. This is all the way of looking at addiction, that addiction is caused by the substance. It is not caused by substance. It is caused by multiple risk factor. The least factor in these all factor will be the substance itself. It is the mental health of the patient, it is the support, it is the social life, it is the exercise, it is the diet, it is the genetic, it is the family structure, it is the history of abuse. These, when you look at these, the more contributing factor, the more difficult the treatment or the longer treatment needed. Thank you.
Very good. I just want to clarify opioids for those who are not don't have a medical background. So opioids are basically certain types of medications or drugs that work on opioid receptors in our brain, which are pain receptors. So like morphine, for example, oxycodone, oxycontin, all those are opioids. And so we've seen a huge surge in heroin as well. We've seen a huge surge in opioid addictions over the past few years, and we now have basically an epidemic of opioids addictions in the U.S. at least. I think probably in Canada as well. Mainly because of I personally think we at some point were kind of prescribing medications for pain a little bit surreptitiously. And anyway, but I just wanted to clarify that. Also wanted to ask you, Dr. Nader, I know we're kind of running, we've been kind of doing an hour now, but I kind of wanted to touch on a couple of things, including your book and how spirituality plays a role in addiction. But I also wanted to ask you about whether you see like certain personality disorders are more likely to have addiction problems, like the DSM divides personality disorders into type A, type B, type C, and I'm just curious if specific personality disorders are more likely to have addictions, and if so, which ones?
Yeah, I wouldn't classify them and categorize them according to, yeah. So which personality? I would say, based on studies, there is some personality traits. I wouldn't say, oh, borderline. This is, we know in borderline personality addiction is because there is mood swings, so trying to find, and there is impulsivity, so they trying to find something to cope with the stress and to cope with depressive symptom. But I would say, if you ask me, personality characteristics which can be a risk factor for addiction, I would say like people who are more rebellious, people who more willing to take a wide range of risk, people who are more sensation seeking, like desire for outdoor activities, they have intolerance to repetition or boring people who are pleasure seeking, people who are more unconventional, people who are less cautious, people who have less emotional control. That's why I like the American Society of Addiction Medicine definition. They put certain criteria for addiction. One of them is dysfunctional emotional response. So one of the symptoms of addiction is dysfunctional emotional response, which means people who have addiction are people who can't regulate and control their feeling. They have ups and downs, they have mood swings, sometimes they have chronic feeling of discontent or chronic feeling of dissatisfaction. So according to American Society of Addiction Medicine, they don't look at addiction as addictive substance. They look at that anyone who have addiction, they also have emotional problem. Oh, you tell me because they take cocaine, that's why it changes their brain chemistry, now they have emotional dysregulation. No. Before they start addiction or using, before they start, even since childhood, they have dysfunctional emotional regulation, which means their emotions are not well controlled. They have chronic feeling of discontent or dissatisfaction or irritable mood or restlessness, or chronic feeling of unhappiness. And then when they get into adulthood, they try to search or find in the environment something that gonna help them cope with this dysfunctional emotional regulation. And it could be porn, sex, relationship, codependency, cocaine, heroin, any kind of addiction. That's why I like more than DSM. because this is what I see clinically. Patients who have addiction, there is emotional problem in all of them, and we need to work on this emotional problem. And they also believe, like one part of the definition is a primary disease, like addiction is a primary disease. Primary means, like they say, some people will have the tendency to be addicted to certain things, okay, and it is basically a genetic thing that cause biochemical changes in the brain that make them more susceptible to addiction. And the addiction is not just reward center problem, it is a memory problem, it is a prefrontal cortex problem, it is a motivation problem, it is a planning problem, so it is a multidimensional problem.
Okay, makes sense. Let's talk quickly about spirituality and how it affects addiction and how it helps with addiction. And then I think Dr. Phil, thank you for joining us. I think he wanted to add something and maybe ask a question, and then we can open up the last 10 minutes to questions. So yeah, maybe just talk a little bit about what led you to write this book. Was it just kind of from seeing all the patients that you've seen and how different factors affect their addiction problems? I'd love for you to talk a little bit about how spirituality plays a role. If anyone's looking for a great book to read about just personal, self-improvement and really kind of being in touch with your soul and spirituality, and this doesn't necessarily mean any specific religion, as Dr. Nader said, I highly recommend his book. But yeah, maybe Dr. Nader, can you just kind of briefly tell us how spirituality plays a role? And then Dr. Phil, would love to hear your feedback and any questions that you had, and anyone else would, if you'd like to ask any questions, feel free to raise your hand.
Yeah, so I to be honest, I don't have the talent to write a book, okay, and especially English is my second language, so I didn't say, oh, I want to write a book. No, it was a push from my team. So I work in my program. We are 4 doctors and 2 counselors and social workers, and it is a collaboration in my clinic with other family doctors and social worker. So they notice that every time I talk, I focus on certain principles, which I wrote the book about them. Then they are the one who told me, and also patient, can you put this in paper? Like, can you write it down? Can you? Then I started putting them down together, the ideas, and then I didn't write a book. I just created a seminar and PowerPoint presentations about these principles, spiritual principles. It doesn't matter you want to call them spiritual principles, you call them psychological principles, religious principles, it doesn't matter, the name, it doesn't matter. But this, I got the motivation and encouragement from the patient and my co-worker who advised me to put it down because they believed or they saw that these values are important for patient recovery. If you look at the studies, if spirituality is an important part of wellness, you will find, yes, studies showing that people who connect with their spirituality, they feel more supported, they feel not alone, they feel peace, love, joy, they discover their true self, they find meaning in life. Spirituality gives them a sense of purpose. It creates also a support network, because if you practice spirituality in a certain way, you get to know other people who practice it the same way. But when we ask how we establish a spiritual connection, this is a little bit different. Some people will use religion, some people will use the 12-step programs, some people will use certain books, some people will use prayers, some people will use ceremonies, sometimes arts and music and singing and dancing could be also a form of spirituality. But if we look at the research, when they look at the spirituality and the impact on mental health, they find that spirituality help people cope with the stress, it induce like positive emotion like happiness, hope, sense of purpose. It also lowers the risk of depression, suicide, and anxiety. It helps people with addiction problem. Also, it helps with social problem in community. I'm not, because religion is part also of spirituality. There is negative side about religion, but we don't want to throw the baby out with bath water. You know this saying that you don't like it. We don't want a black and white thinking. If you don't like something about religion or a certain religion, it doesn't mean that spirituality, all spirituality are bad or have a negative side. To summarize, like the book, I don't wanna. So I can talk hours about the book, but the book is mainly about 7 principles. The patient will need to practice them. It is a foundation. As I mentioned at the beginning, there is a foundation for recovery, right? Like a biopsychosocial spiritual. This is the main approach for treatment plan for any disease. Also for a spiritual connection, I believe there is certain principles that are very important in mental wellness. One of them is non-attachment, and second one is non-judgment, then acceptance, then unconditional love, and powerlessness, and gratitude, and hope. These are the principles that I teach in the book, and I put them how to practice them in practically, like what do you mean by non-attachment, what do you mean by unconditional love. And if you ask me, out of the 7 principles, which ones are the most important, I would say the non-attachment and the unconditional love. These are the main ones that you need to focus on when you practice spirituality. Thank you.
Wonderful. Thank you so much for that. Dr. Phil, I'd love to see what your thoughts were and see if you had any questions. And if anyone else, please raise your hand if you had any questions. We'd love to hear.
Yes, thank you so much, Dr. Christine and Dr. Nader, for providing this room today. This is something that I think is very much needed and very important in our world today, and it's something that I'm passionate about myself in helping people that are struggling with addiction. And I want to applaud you for Dr. Nader for taking the approach with the soul and spirituality as well, because I see this is a huge factor with so many people that are struggling with addiction. My wife does is part of a prison ministry that goes into the women's prison here and tries to help the women that are in the find themselves in the prison system, and try to help them get out and get into rehab programs. And the one that they try to get them in is a spiritually based program that has a 70-something% success rate. And but my wife tells me that these women that she works with in the system, they are soul sick. The majority of them are, and it's something that I have talked a lot about in helping people in describing as soul sickness. People have wounded souls from whatever reason, the trauma that they grew up in, or some type of bad relationship they were in, and they're trying to cover up the pain, and they're trying to do that with medication or drugs, sometimes prescription medication, sometimes street drugs, and sometimes alcohol. And it's something that I think is touching every family. It's touched my family. I've had a brother that dealt with addiction. I've had a sister that has dealt with addiction as well. Thank God it didn't affect me. I took some measures early in my life, I believe, to prevent that from happening, because I had a grandfather that was an alcoholic for a period of time until he got his life right and had a spiritual experience that changed his life. But anyway, I just want to say thank you for what you're doing, and thank you for your work in trying to help people that are struggling with these things. But I do have a question I would like to ask, because as a pharmacist, I have counseled with a lot of addicts myself over the years, and tried to help them, get off of primarily the opioids. Most of addicted to opioids, and I'm working with people now that struggle with different types of mental issues, and one of the I work with a lot of ADHD kids primarily, not so much adults, but kids, and I'm wondering, in the field of in our field of medicine, why, as Dr. Christine was talking about root cause, is why there's not more functional testing done to check for neurotransmitter deficiencies, and to look at nutrient deficiencies as the root cause. I know, we people that would come into my pharmacies for many years. I had pharmacies for many years. I'm not behind the counter anymore. I do telehealth and do health coaching, but I'm wondering why there's not more testing done in the health in our health profession, looking for these root causes. And we put people on medication, these that are receptor agonists and receptor antagonists, and reuptake inhibitors, and all these medications, and trying different ones, hoping one of them's going to work. But I don't see a lot of testing being done to try to get to that root cause. So I'm wondering what your perspective is on that, and why you think maybe it's not being done like it should be. And maybe it is in some parts of the country, but I know here where I live, there's not any doctors that are doing functional medicine testing or doing genetic testing even to determine what the root cause may be, or what medication may be the right medication for that individual. So thank you again. I'll pass the mic back, Dr. Phil. Thank you.
I'd love to address that, because I'm so glad that you brought that up, and that is actually a huge part of my evaluation with patients when I see them, is I do neurotransmitter deficiency checks, because like you said, this is crucial for our physical and our mental health. I mean, our gut-brain axis is so strong and powerful. And I've diagnosed so many people with dopamine deficiencies, but not only dopamine, serotonin deficiencies, GABA deficiencies, acetylcholine deficiencies. These are our four main neurotransmitters, and they all have specific functions in our body that control our cognitive and our mental health. So I'm really, really glad that you brought that up. I personally do it with all my patients because of the importance that I know. And like you said, I think we really need to start focusing on root cause, on diet. Just for example, dopamine, which we just spoke about in detail regarding addiction, and people who really need that dopamine surge all the time and may be deficient in dopamine. You can easily increase your dopamine levels through food, through certain types of food that contain the precursors of dopamine. The precursor of dopamine is phenylalanine, as you both probably know. And, phenylalanine is an amino acid that is not made in the body. We have to obtain it from food. So if we're not eating foods rich in phenylalanine, well, what's going to happen is we're not going to be making enough dopamine. Our gut produces dopamine, our brain produces dopamine. So, I personally, I'm hoping to, make changes one person at a time. And I've seen huge improvements in patients of mine that have done a wellness evaluation with me and have, sometimes like severe dopamine deficiencies. And then, they have symptoms of ADHD, and they didn't have ADHD when they were younger. And then I tell them, well, it's because you're not eating enough food that make dopamine. And then we correct that. And then they tell me this is, miraculous. It's better than any medication that I've taken, because now I know what to eat. So I personally, I'm working my best to try to do that. I wish other doctors and healthcare professionals would be also on board, but I think we're getting closer to that. I think, nutrition as part of a medical school curriculum really needs to be incorporated, and hopefully in the near future it will be. I'd love to hear Dr. Nader's point of view on that as well, but great question, and thank you so much for sharing your thoughts, Dr. Phil.
To be honest, I'm not aware of any. I have tried the genetic. I sent some patient to genetic testing for certain disease, but or genetic testing to know which antidepressant will work better for them. But I didn't see any success in this regard. Like the way I look at it, like me personally, I don't have a way or a test to identify where the deficiencies are. What I do, I improve, I identify what are the risk factors, I work on improving all of them. Which one will be helping more than the other, I don't know. I don't have the tools. Dr. Christine, she maybe she does further functional assessment. As part of my program, I don't go deeper, or I don't have the knowledge and the training how to assess the lack of these chemicals, but I will explore what kind of diet the patient is doing, how active the patient, how is his sleep, family history, mental health, psychiatric history, and then I address all these areas and I work on all of them. I can't tell, is this guy gonna do better if he exercise, but we don't have to focus on diet, or just diet will be solving the problem. No, I focus on everything. And also there are the gut health. I work on improving the gut health of my patient through probiotics or changing their diet and stuff like that. But I'm not, regarding assessment and the questions that Dr. Phil proposed, like how you're gonna assess what is deficient. To be honest, I'm not aware of any technique we can use to assess these deficiencies. Thank you.
I do a neurotransmitter questionnaire, which is a very thorough questionnaire that addresses symptoms related to the specific neurotransmitter deficiencies. And then based on that, based on the medical exam that I perform and the symptoms that the patient's having, we come up with usually like a specific foods unique for that individual to help increase their neurotransmitters that are deficient, but also certain supplements are really good at increasing them as well. So, and we see huge improvements in the way that they perform mentally, cognitively, behaviorally as well. Abrar, I think you were next. Thank you, Dr. Phil. Thank you so much. Did you have a question? Abrar, are you still there? Okay, we'll come back to you. Marie, how are you? Thanks for joining us.
I'm great. Thank you for all of you. I was wondering.
Can you speak a little louder?
I was wondering, women with addiction with Dr. Nader, does he notice that the women that come to addiction, they have more symptoms with abusive behaviors, intimate partner abuse, and trauma versus the male patients?
Dr. Nader, did you hear that question? I know she was a little low. If not, I can repeat it.
Yeah. Did she mention something about trauma, history of trauma, and it's different from male to female?
Yeah, if the women that you see with addiction problems, if they're more likely to be in abusive relationships or history of trauma versus the males that you see.
Yeah, I can tell. Yeah, there is the effect of trauma in women who could be different than men, because there is psychological differences, the way men and women react to trauma, and it react psychologically. There is differences. I know that there is some people who say, there is no gender rules, and but still, if you look at the study, there is like, for example, men tend to, or the masculine traits tend to be more goal-oriented, maybe women will be tended to be more relationship oriented. That's why when trauma or abuse toxic relationship can affect women more than men, because this is their main area of interest, or this is their main focus, or this is how they work on their self-esteem, or this is a positive, they see life positively through relationship, or versus men. Look, again, we can't generalize. I can't say, oh, so all women focus on relationships, they don't care about goals, all men care about goals, and all women, and they don't care about relationship. It's not like that. But if we want to look at the focus on feminine traits will be relationship oriented, when on men will be goal oriented. That's why if there is a relationship problem, I think it's gonna affect both. If you are going through divorce or you are in a toxic relationship, both male and female will negatively affected, but I believe it will be on the more negative or devastating effect on female more. Thank you.
Why do you think that is? Why do you think it's more devastating on females?
Because there is psychological differences between men and women.
Makes sense.
That's why, and if you look at the study and the survey, you will find there is major psychological differences between men and women. I'm not saying that this one is better than that one, but or men is better or stronger, or women is stronger or more intelligent. No, I'm saying there are certain things that both are the same, psychologically are the same. But for example, aggressiveness, for example, men are more aggressive than women. You tell me no, but I know some women are no, but to the percentage, you'll find men are more aggressive than women. That's why if you look at the prison has, is it more men or more women? You'll find more men. Also, addiction is more prevalent in men. If you look at the study, who suffer more with substance use disorder is men. If you look at depression and anxiety, is more prevalent in women. So there is psychological differences. The question will be why there is psychological differences. The debate will be here. Is it biological? Is it a social thing? Is it environmental? Is it evolutionary things? I believe personally it is a combination of all of them. But what I can tell now, there is differences in psychologically between both. But why? Yeah, there will be a debate why, but there is. Thank you.
Yeah, that makes sense. I think that there's a lot of societal effects of that, as well as hormonal, right? I mean, I think testosterone, we know, can affect aggression. But yeah, very interesting. Thank you so much. I think Abrar was trying to come on, but she might have some, I guess, Wi-Fi issues. So, Abrar, are you able to speak, or do you want to type in your question?
Yeah, hello everyone. I hope you're doing great, and it's a great honor for me to participate in your club. So, I know that addiction is when you're crazy about something, love it more, and would like to do it every day, at least. But my problem with, firstly, I have a question. Is it necessary to be addiction for something you are not professional when you come to do it? Like I will give you example to clear the idea. Okay, so I have problem with mathematic equivalent. So when I try to solve one of the equivalents, I suffering a lot. I do understand the equivalence, but I love to solve the equivalent every day. But the problem is, I know in myself I'm addicted to, but why I cannot be professional in this? I hope you get my question.
So,
Dr. Nader, did you
yeah,
want to? Yeah.
so the question is, you are addicted. What kind of addiction you struggle with? This is the first question.
Yeah, I'm an accountant, and sometimes in my study I face problem with solving equivalence formula. Okay.
Yeah.
Mathematics formula. So when I love to solve this formula, but sometimes a little things prevent me to solve the problem. When I see the result, okay, I found myself I just made mistake in a simple thing, and these things make me like destroyed myself. I see myself so stupid. Why I lost this small step to let the result be wrong. So these things make me like I don't know how to explain it, but trying to make myself so stupid and hate study and all this stuff.
Okay.
Abrar, I think it might be better to like your question is kind of detailed and personal, and I don't know if it's necessarily the best platform to ask that kind of question. If Dr. Nader wants to kind of just answer in a general format as to why certain people have what you're describing, and then you can always feel free to request to speak to him. But I think just for time's sake also, because we kind of running over an hour and a half, it might be worth just kind of asking that question more for a consultation basis. But Dr. Nader, feel free to just kind of give her a general answer, and then I think we're going to have to wrap up the room soon. Thank you so much.
Yeah, I think the question is mainly about, if you like something and you like doing it, but yeah, sometimes you fail at it to some degree, then it affects your self-esteem, and you feel bad about it, and you feel that you are not, even you like it, but you're not doing it that great in approaching the problem or the equations or the equivalent.
Exactly.
Yeah. So I would say to fix a problem like this, we need to work mainly on self-esteem and building more self-resilience. So we all gonna go through challenges in life. It doesn't mean sometimes we're gonna fail at certain area in our life. Okay, sometimes it is minor, sometimes it is major, but if we have a stronger self-esteem, we'll be able to cope with these stuff, daily challenges, much easier. So I will go back to basics, which how I'm gonna improve my self-esteem. I would go the biopsychosocial spiritual. So I will need to be exercise, take care of my diet, sleep better, journal my feeling, see a counselor if needed, do CBT, because it's gonna be the most effective technique for self-esteem issue. Improve social life and talk to people I trust about these minor challenges in my life, because sometimes just talking to others gonna help and lessen the sadness or sense of failure or disappointment or frustration. And the last part, again, the spirituality, like to connect with our spirituality, if it is through religion, like prayers, meditation, contemplation, all these techniques to help with the spiritual connection. So the more you work on all these areas, okay, the self-esteem will be higher and higher, and when the self-esteem is higher, you're gonna be able to face the challenges more effectively without the challenges putting you down. Thank you.
Thank you so much, Dr. Nader, and thank you everyone for questions. We're going to wrap up the room pretty quickly now. I believe Dr. Nader was able to record this, so I believe he's going to post it on YouTube. Please follow Dr. Nader on Instagram and his YouTube channel, as well as order his book, which is, I think, a really great book to read. If you want more informative topics, please follow the speakers, follow the Gut Healthy Club, follow us all. I think we're all on Instagram also. so you can be aware of any future talks. And thank you everyone for joining. Dr. Nader, Dr. Phil, anyone have anything else to add before we close the room?
No, thank you, Dr. Christina, for the invitation. And yeah, I hope in future we can run sessions like that, and both English and Arabic. Thank you.
Looking forward to it, and thank you again, everyone, for joining. Thank you, Dr. Phil.
Thank you guys so much. Appreciate you again for doing this and for bringing this to people's awareness. Grateful for it. Thank you.